Thanks for joining us for the daily update. First things first, we have 13,035 cumulative cases of coronavirus in Victoria. That's 725 more than our last update. I'm very sorry to have to report that the total number of fatalities due to this global pandemic is now 162 Victorians. That is 15 more since our last update. I'll provide you as much detail as I can. One male in his 30s, 3 males and 1 female in their 70s, 3 males, 3 females in their 80s, 3 males, 1 female in their 90s. Of those 15 cases, 12 can be linked to aged care. If we can provide further information to you, then of course we will, subject to privacy and obviously prioritising the grief and loss that those families will be experiencing. Can I send my heartfelt condolences and sympathies to each of those families? This will be a terribly difficult time, and any and all support that we can provide to you, we will, and we are with you in this very difficult time. 1,721,953 tests have now been conducted across Victoria. That's, as I've indicated to you the last couple of days, we'll give you from the laboratories an estimate of tests done each day, and the exact number gets added to the total. But with a little bit of lag, we are focusing on those positive cases, so tallying up to fine detail the number of negatives is something that happens a little bit later than it was happening. So about 24,000 tests were conducted yesterday. The laboratories have confirmed that. There are currently 528 people in hospital, 538 I should say, and 42 of those people are receiving intensive care. Total active cases 7,227, and total active cases with a connection to aged care some 1,435. Can I, off the top, thank all of those Victorians who are coming forward and getting tested. It is arguably the most significant contribution that any of us can make. If you have symptoms, however mild, you need to come forward and get tested, then isolate, waiting for your testing result, and then act on the advice that you're provided if in fact you are told you are positive. Yesterday we talked about door knocking, compliance, we talked about penalties. Those penalties are there for a good reason. They're there to keep everyone safe and to try and promote the very best choices. But I'd simply ask all of those Victorians who have perhaps not been making the best of choices, please change your behaviour. To all of those who are doing an amazing job, I'm so grateful and so proud to think that Victorians are dealing with this challenge, a bigger challenge than we have perhaps ever faced. And they're doing it with a sense of compassion, a sense of care for each other, a sense of concern, of course, but that really clear understanding that we are all in this together, and the decisions that each and every one of us make as individuals, as families, as communities, they have an impact on all of us. And if we all continue to do as we should, making better choices, then we'll keep our community safe and we will get to the other side of this. The alternative, of course, is these restrictions lasting for much longer than they should, and all the attendant pain and suffering and damage that is simply unavoidable because of where we find ourselves, because of these restrictions and the fact that they are the only thing that will pull these numbers up, being even greater than it otherwise would be. No one wants that. And that's why I would appeal to every single Victorian to follow those rules. But I wouldn't want those who are following the rules, I wouldn't want their amazing work to be downplayed in any way. They're making an amazing contribution. You are making an amazing contribution, and you both have our gratitude, but also you have a clear acknowledgement, I think, from all of those who are on the front line, all of those who are ultimately the last line of defence. We acknowledge how hard it is, and we acknowledge just how important it is as well. Now, on a couple of specifics, particularly in relation to work permits, I think you've all seen those, and we're very grateful to you for making sure that we get the message out around those work permits. That is a relatively simple process, but one that will mean that police can enforce these rules much more easily, and that we really can have the minimum number of people moving throughout the community, the minimum number of people working. That they're always difficult decisions to make, they're always difficult lines to draw and lists to write. And we apologise for the pain and the hurt that those lists, that those sorts of decisions make necessary. But these are the decisions I've made because they are the only option we have in order to try and drive these numbers down. So that process is working well, I think, and it is a relatively simple process. I wanted then to focus on two other issues. Firstly, childcare. And I know and understand that this is a really significant and serious issue for so many families right across Victoria. Yesterday I said that we would work as hard as we could to try and find a way through on this, but I didn't want to give anyone false hope. There will need to be, and I can today announce there will be, many families who will not be able to access childcare as they normally would. And that is essential to driving down movement. It is essential to driving down these numbers. What I can say, though, is there will be a further permit system. It'll be as simple as possible. It's quite a simple process. But if you are a permitted worker, regardless of whether you are working in person or you are working from home, and you attest that there is no one else in your household that can look after your children, then you will be able, with that very simple permit, to access childcare. I know that that will mean many people who have been using childcare and rely upon childcare will not be able to do that. These rules, I should stress, also apply to kinder, and they will essentially apply to primary school students attending school and being under the important, basically doing remote and flexible learning in a supervised environment outside their home. I know this will cause significant concern and it will be very challenging for many families. But if I were to simply green light the best part of 250,000 kids going to and from childcare every day, then we will not drive these numbers down. These are very difficult decisions to make. I know they have direct impacts, but just to be clear, if you are a permitted worker, regardless of whether you are working from home doing that permitted work or whether you are in person doing that permitted work, if you attest through that quite simple permit process that you have no one else to look after your children in your household, then you will be able to access childcare. That will mean a very substantial reduction. We're just doing the final numbers on what the difference between a full complement and the much smaller number will be, and we're happy to come back to you on that once we've tallied all that up. But it is a massive reduction, and I apologise to those families who will do it tough because childcare is not there, but there is simply no alternative. We've worked through this right throughout the evening to try and get a balanced approach, one that allows those, to give you one example, people who are directly involved, whether it be at work or at home, in our collective fight against this virus. We didn't want that effort in any way undermined because childcare was not available to them. That, I think, makes perfect sense. I'm not for a moment pretending this will be easy. It will be very challenging. I wouldn't make these decisions if I didn't think that it was exactly what's needed and necessary to drive these numbers down. And when you look at today's numbers, and they do jump around from day to day, but the notion of more than 700 cases, that is not sustainable. We need to drive those numbers down, and this strategy is designed to do just that. That's the advice of the experts. That is the decision that I have made. Finally, before we go to questions, I can also announce today that elective surgery other than for Category 1 patients and the most urgent of Category 2 patients, those clinical decisions, that clinical need will be determined by doctors and others. All surgery beyond Category 1 and the most urgent Category 2 in regional Victoria will be put on hold until further notice. We can't have a situation where we are making the sickest patients wait longer because we are treating wholly worthy and important conditions, but not necessarily time-critical conditions. We can't put those ahead of people who need that urgent care. The sickest patients must get treated quickest. That is always a principle that our public and indeed our private hospitals work under. This is a regrettable decision, but it is a very important one in order to preserve sufficient capacity in our entire health system, city and country, public and private. No one enjoys, particularly a government that's done more elective surgery than any government in the history of the state. I don't enjoy having to make these decisions, but in terms of keeping patients safe, keeping hospital workers safe and preserving sufficient capacity so that we're planning for what might be needed, we hope not needed, but things that might be needed, we need to mirror the restrictions that have applied in Melbourne for a few weeks now in regional Victoria as well.